Good evening, everyone. My name is Stephanie Lowry, and I'm the Plastic and Reconstructive Surgery Manager here at Kingsbridge. I'm absolutely delighted to welcome you all to the third webinar in our ongoing series showcasing the breadth of services we offer in plastic and reconstructive surgery at Kingsbridge. Over the past few months, we've heard from 4 of our expert surgeons covering a wide range of topics, including breast augmentation, breast reduction, abdominoplasty, rhinoplasty, and facelifts. If you've missed any of these sessions or you'd like to revisit them, they're still available to watch on our YouTube channel, and I'd really encourage you to take a look. Tonight, we continue our mission of introducing you to our remarkable team, offering them a platform to share their deep, unrivaled expertise, not just in surgical techniques, but also in the high standard of patient care that defines us here at Kingsbridge, both in Belfast and the North West. Patient care is at the heart of everything we do. It's our guiding principle and the foundation on which all of our work is built. With that in mind, tonight's focus is on pre-operative optimization, the steps and best practices that can help prepare patients for surgery, ultimately leading to better outcomes and smoother recoveries post-surgery. It is my great pleasure to introduce this evening's speakers, Ms Ciara McGoldrick, consultant plastic surgeon, and Ms Pauline Doran-Williams, plastic surgery nurse. Ciara and Pauline have worked together for 6 years here at Kingsbridge, in fact, right here in this very building, one of our outpatient centres in Hollywood. Ms McGoldrick is a consultant plastic surgeon and oncoplastic breast and reconstructive microsurgeon. There we go, with a particular focus on the treatment of women with breast cancer. Her area of special interest is breast reconstruction, and she has completed comprehensive training that enables her to support patients from initial diagnosis right through to surgical refinement. She specialises in free flap reconstruction, particularly DIAP flap reconstruction of the breast. Pauline is an experienced plastic surgery nurse with over 21 years of service, supporting both pre- and post-operative patients across cosmetic and reconstructive procedures. She brings a wealth of experience in traumatic, reconstructive and aesthetic surgery, and her previous work includes time in one of the busiest oncology intensive care units in the UK. Tonight, Ciara and Pauline bring exceptional knowledge, compassion, and dedication to their practice. We are thrilled to have them here with us this evening to share their insights. Now, before I hand over to our speakers, just a quick reminder. Please feel free to submit any questions you have during the talk. We'll have a dedicated Q&A session at the end, where we'll do our best to answer as many questions as possible. If you have any follow-up questions after the session, or if you'd like to arrange a consultation, you're very welcome to get in touch with me directly via email. You can also visit our website, Kingsbridge Private Hospital, to book a consultation online at your convenience. Now, thank you once again for joining us this evening, and now I will hand over to the experts.
Thanks a lot, Steph. Thank you. So, evening everyone, and hope it's coming out loud and clear. So we really just want to talk about patients in the run-up to surgery and quite often what comes across. And first thing we always say to our patients, there's no such thing as a stupid question. So at the end, if you're thinking of anything that's coming to mind, feel free to type it away and we will try and answer it at the end. And while some of these are my specific instructions, all surgeons will have their own specific recommendations. And so it would be important to clarify with them if there's any specific thing that you are interested in or have a particular question about. And your surgeon's only really going to want to proceed with your surgery when they're happy that they have your informed consent. And that means learning about all the things that may go wrong, as well as all the things that you hope goes right. And that's something that we take quite seriously in our practice, Pauline. And so after patients will meet me, we'll have a long discussion about what the surgery we think that might be suitable for you. And we have a preliminary discussion about the risks and benefits and the downsides and upsides of some versions of surgery. We'll then spend another quite lengthy consultation with you, Pauline.
Yes, and during that we talk about all of the risks and all the complications that may happen, even though they're very unlikely, because some patients think that they're going to breeze through surgery, which yes, a lot of them do, but some of them do have problems, and it's important to know that these problems are a potential, and then you can make an informed consent to surgery.
And I quite often say that Pauline is the worst salesperson ever for plastic surgery, because with all of her wealth of experience, she's seen lots of different things that can potentially go wrong with patients. And so you want someone who's able to fill that in from a slightly different angle than me as a surgeon. And that gives you the time and space to think about these things. And if some of these things do go wrong, how it would affect you and your life and your family, and feed that into your decision making on how you want to proceed. So if we're talking about preparations for surgery, We often talk about in different groups. So the first things we'll talk about is the physical preparations. And quite often people, when they think about coming to see a plastic surgeon, almost as soon as they're in the door, they'll say to me, oh, I'm at this weight, or I would like to lose more weight, or I've lost weight. And the physical weight seems to come in a lot into the conversation. And part of that is you need to be a safe weight to proceed with the general anaesthetic, because if your BMI is over 35, it can be risky for you to have a general anaesthetic. And that's a real hard line that neither I or Pauline will be able to cross. The anaesthetist really determines that, and we respect that and adhere to that. This is not an emergency situation. This is an operation that you can or you can put off to another time. So that's really the big cutoff. However, quite often people's bodies are transitioning and either they're in the process of losing weight or they're close to their goal weight. And that's either through diet and exercise, and more recently with some of the newer GLP-1 medications that are now so commonly being used. So any advice that you would normally talk to patients about that, Paul?
What we would say is we would like you to think about surgery when you're at a static weight, so no wildly fluctuating weights. It's very important nutritionally, it's very important for your body, it's very important for wound healing especially. You can be very healthy weight but still be nutritionally deplete, is what I say to patients, especially in protein, vitamin C and zinc. So that's something to take away with you to think about.
So quite often I will say to someone, I would like you to be at your static weight, your maintenance weight, whatever that is that you feel is your healthy weight. And that's something and a weight that you can maintain without too much effort. It can't be that you're being your best version of yourself with not one mouthful of chocolate or glass of wine past your lips, because that's not sustainable. So we want you to be at a manageable, healthy weight for at least 3 months before we would consider surgery. And that's because in those 3 months, then your body is able to build up all the nutritional deficits that will have occurred during your weight loss. So your liver has time to build up all the nutrients again, and your body will draw on all of those stores whenever it comes to having surgery, because surgery is essentially a big insult, a big drain to your body, and you need to have everything there ready for it so that it can do you the best justice in terms of healing your wounds. So in terms of nutrition, I'm a bit of a protein advocate in that I want my patients to eat at least 90 to 100 grams of protein per day in the 6 weeks leading up to surgery. And that is nothing to be sniffed at, in that most women, especially of a certain age, tend to eat more in the realms through 45 to 50 grams of protein a day. So you're doubling the amount of protein that you're getting in every day. So that's not just 2 eggs in the morning, because 2 eggs in the morning would be 6 grams of protein. That's essentially the equivalent of 3 chicken breasts every day in the run up to your surgery. So that's a big change for most people. And it can be hard transition to make. But again, if you think those protein are the little building blocks that your body's going to use to lay down the scar tissue in order for your body to heal well. Also, in a period of inactivity after surgery, your body will lose muscle. And as women, it's really difficult for us to build muscle in the first instance. And so losing muscle as a result of inactivity is really hard to gain back. So that protein intake is really to try and boost that. And then we'll talk a bit more about supplements.
Yes, so for all patients, we encourage them to increase their vitamin C, either using a supplement or increasing it in your diet, which can be quite difficult. Zinc is very important. Again, it's often better to supplement. In fact, a multivitamin covering all the bases is very good. There are a number of products on the market, indeed there are, and it's good to do your research before you start taking any of these supplements, but they are very beneficial to your body. Protein is quite difficult, and sometimes supplementing protein with yogurts, etc. is useful. And 6 weeks is a good time to get your body prepared. It takes a lot of planning. It takes a lot of meal planning, which is something that you probably wouldn't even link to having surgery, but it is very important for your recovery before and after your surgery.
And then going along with that is exercise. So we would be encouraging you to walk 10 to 12,000 steps per day. And that would be, even if someone who's never done that before, I would be encouraging you to be up to that, because you really need to be at that sort of level of physical activity so that you can cope well with the anesthetic and cope well with the rehabilitation afterwards. So whatever it is your normal exercise is, you can keep doing it right up to the day of surgery. There's no need for you to stop. But if you're not a particularly active person, I would encourage you to get active in those 6 weeks again before surgery. There's evidence that every time our muscle contracts, it releases these chemicals called myokines, and those myokines are anti-inflammatory. And so you want your body in as the most chilled relaxed state possible. So all that walking releases all those myokines and gets your body really prepared for whatever we have in front of you. And the obvious things are, in terms of healthy lifestyle, then is the obvious what you shouldn't do.
Yes. No vaping, no smoking, and really restrict your alcohol to social alcohol only. Smoking can have very derogatory effects to your wound healing. And this is something that has been tested. Many papers have been written on this. And really, for you to have the best result that you can possibly have out of surgery, which is, through choice, it's important to prepare for this situation.
And we both have examples over the years of wounds where we were really struggling to get the wound to heal, and we were trying to scratch our heads, and then it becomes clear that the patient's continuing to smoke. Even 3 or 4 cigarettes a day can be enough to stop the wound from healing. And if you're making the transition from cigarettes to say patches, for example, or nicotine replacement, by the time you get to the time of surgery, you need to be on a 0 nicotine intake. So you can switch on to a nicotine patch and then reduce it down and down and down. And for some people, that means that you need more like a 6-month run up to surgery, because it's going to take you that time to get off the nicotine.
I know that all of these restrictions that we're discussing can be quite frightening, but they do, and it does deserve a lot of preparation, but it will finesse your result, and it will make you happier that you've gone through surgery and recovery.
Okay. Then on to medicines. So obviously we can't cover every single medicine that's important in the time they run up to surgery, but the common things, considering a lot of our patients are women, are things like the oral contraceptive pill. So the combined oral contraceptive pill has oral estrogen in it, and oral estrogen in any form increases your risk of developing a clot in the leg. So we will be encouraging you to stop the combined oral contraceptive pill some 6 weeks prior to surgery. And that might take some preparation. So if you're on it for contraception purposes, you need to switch to some other form, because the one thing that will give you a clot in the leg more than the combined oral contraceptive pill will be in pregnancy. So we want to make sure that we've covered all those bases. And similarly, if you're on it for period management, it might be that you need to go back and talk to your GP about potentially something alternative in the time through that. Similarly with hormone replacement therapy, so it's really the tablet version of estrogen that is problematic. So if you use an estrogen patch or an estrogen gel, or you take just progesterone orally, you don't need to stop that in advance of surgery. And I know for some of our ladies, the thought of stopping their HRT in advance of surgery is really scary, and their families, So we would encourage you to talk to us about that, and we can give you specific advice about it. And it's really just about reducing the risk of clots in the leg. And so if you're someone who has had a clot in the leg before, or a strong family history of that, there may be other things that we need to do in terms of starting on a blood thinner in advance of surgery, but we can discuss all that. But I suppose the pill and the HRT are probably the 2 biggest ones. And then in terms of blood tests, you might need to have, if you're somebody who has had a lot of heavy periods, we may check for anemia, which is low blood count. And that's because we know that even a very mild anemia can cause problems with wound healing, and it's going to make your rehabilitation really tough in the weeks and months following surgery. Again, if it is a problem, we can start you on some oral iron, but we only know that if we have taken the blood test initially. So if you do have heavy periods, that would be something important to mention to us.
And it can affect your condition when you're recovering. You may feel a lot more tired than what you expected. You may feel exhausted. So it's important to be clear with us when you are coming in for your first consultant appointment, any issues or any history that you do have. It's important to discuss it.
This is quite a big list.
Yes.
What do I need for hospital? It reminds me of the one that you would have got before you were going to do a baby. Yeah. Huge list. So, those the standout ones for me are a water bottle, in that whenever you're in hospital, the best one in the world is always slightly out of reach. So a good insulated water bottle you can tuck in the bed beside you. And then a phone charger, always useful. And a sleep mask and earplugs, I think, was the thing that stood out to me. And lip balm.
Yes.
Another one.
And toiletries to treat yourself with, toiletries to use that you'll probably never use again. Yeah. But this is, it's a special time coming in for theatre, and it can be quite frightening. And it's always nice to have a little treat or something that you would never use.
Yeah. And similarly, we won't bat an eyelid if there's some special pillow / teddy bear / blanket.
I think that's important.
we won't bat an eyelid. So, and if that's what you need and to make you feel comfortable and at home, that's what you bring with you. So there's huge lists out there on the internet, and you will know yourself, but bring everything that you think you need and probably a little bit more.
Yes.
Yeah. Super. And this is really Pauline's trying to sort your life out
Before surgery. Family is very complex. Life is very complex. It's important to make your transition from hospital to home as easy as you can. And that may involve delegating household tasks to somebody else, so that you have the best recovery that you can have. Preparing your home seamlessly so that you come into the hospital environment thinking everything's controlled at home. Ideally, we'd like you to take about 6 weeks of heavy manual work, which when I say that to a lot of ladies, they feel frightened because they think, oh, I have to ask somebody else to do that. It's important for your recovery. This, as I've said, this is surgery that you may have wanted for many years. This is surgery that you have reached the special time in your life where you think, now I can do this for myself. So this is something that needs a lot of planning, and delegation will be your best friend in that point of view. Getting your freezer ready, getting your kitchen ready, getting foods in, all those basic things that you never really think about before, a life event is very important. I've known patients to get cleaners for their home after their time in hospital. I think that's a wonderful thing to do because it takes the pressure off and it takes the stress out of life at home. Getting friends and loved ones to help you is also very important. And I understand that plastic surgery is something that many patients don't want to talk to others about, but a little bit of help sometimes is a good thing at this stage in your life.
And we all have instances of things that have gone hard. I had, patients who've fallen off a ladder while they've been washing their windows 2 weeks post-op. You think,
yes,
and all you can think of is, what on earth were you doing cleaning your windows?
So you have to follow the instructions that we give, because we're not giving them thoughtlessly. We're giving them with your best interest in mind.
Yeah. And somebody having a person who can drive you, because you're not going to be driving for the first couple of weeks after surgery. But there may be an unexpected visit. We normally try to plan out our visits very well and that you'll be supported at home. But occasionally things crop up and you decide that you need to come to the hospital to see us at short notice, and then you need someone there on hand that you can just pick up the phone who knows the whole backstory. And as Pauline was saying, some people can be very embarrassed and a bit, this is a very personal thing that they're changing their body and they don't want everyone to know. We would always be encouraging, even if you tell one important person that they know, so that you can have a backup if things don't go according to plan. So, and the life admin is probably the best one. Similarly, people say, well, how much time do I need off? Could I work from home? I say clear your diary for 2 weeks, because for those 2 weeks after surgery, it's rare that you're getting a really good night's sleep. You're not really the best version of yourself.
Yes.
You're a bit sore, you're taking painkillers. That will be the time when you send a, reply all email to, to your work colleagues that you shouldn't have sent. Those will be the times when you don't make the best decisions, and you just need to give yourself that headspace to take the pressure off. And that is difficult. And, I think both you and I would both struggle to do that, but say this is hopefully a once in a lifetime event that you're planning for, and you might as well try and get all your ducks in a row and have everything playing in your favor.
And what I say to patients sometimes, it's better to often overestimate your recovery. So tell your employer, oh, I won't be back for 6 weeks, or I might not be back for 6 weeks, depending on your occupation. And if you're back early, well, that's a bonus, but best just overestimating rather than underestimating and then needing to take sick time off and work time that you wouldn't have planned on taking.
Yeah, because that then leads to a difficult conversation that you don't want to have, and everyone wants to avoid. Okay. So this has come up to life events. So I was trying to find some photographs of generic. I couldn't find any. So these are my life events. So that's my little son there who we were heading off traveling. And so when people talk about their life events and surgery, people tend to think of, oh, I'm going on this once in a lifetime trip, and now I want to have my surgery. So really, you need to have a good 6 weeks before you're planning to travel. That's for the risk of clots in your leg. It's also the risk of, you don't want to be in the other side of the world having a problem with a wound and trying to scrabble through a foreign health service to try and get what you need. So we will encourage you to leave at least 6 weeks between any big important trips. And that can be an important trip that happens to be, nearby. If you're flying to England to see family or whatever, that includes it. So it's not just the risk of clot in the leg, it's all of the stuff that goes around it. And we want you to enjoy your trip whenever you're going. Yes. We don't want you to be second guessing. And there's nothing worse than someone it's right up to the wire and they're nervous. Is this all going to be healed? Or am I going to be ready to go on my holiday? And the nervousness that goes along with that Never mind, it may negate your travel insurance, which is another stress that you don't want to get into. I would say you really need 3 months would be the absolute bare minimum before someone's getting married.
Yes.
And when I say the person getting married, that's also the mother of the bride, the mother of the groom, all of the appropriate bridesmaids, all of the wedding party coming up to this, because again, you just can't predict. And you want everything, all the swelling to have gone down. You're going to have dress fittings and all sorts of appointments, which you want to be able to enjoy in the run up to the big day, rather than pushing it all in at the last minute. So 3 months is what we.
It's very realistic. Final result, I will tell all the patients that you'll have your final result by week 12.
Yeah, and then you'll be able to, you know, show it off and enjoy it. Then whenever it comes to pregnancy and breastfeeding, you know, the evidence is that your body takes such a hammering after pregnancy and breastfeeding that it really takes a year for your body's reserves to rebuild again. So to then have another surgery in that time frame really puts your body under a huge amount of pressure. They say it takes 9 months to grow a baby. It takes at least 9 months for your body to go back to again afterwards. And the elasticity in your skin is still recovering. So you're working with a moving target, never mind anything else. But and you have the pressure of having a small child that you're then looking after. So a year after pregnancy and breastfeeding, even whether it's breast surgery or non-breast surgery, I would say a year is probably the minimum, because a 1-year-old is an awful lot easier to deal with than a 3-month-old. And I think that we've both had experiences of patients where they've had surgery before then, and the wounds have struggled to heal. And then that's a real disaster.
Dramatic.
Yeah. All round for them and us, you know. So, and you're just trying to, as you say, the realistic journey.
Just the realistic journey. You know, a lot of patients would wake up and be expecting to be fabulous from day one. And yes, there can be a bit of a wow factor, especially if it's surgery that you've wanted for a long time and there is a major change to your body image. But recovery is hard and recovery is long, and that's totally expected. So please be realistic coming through your journey, because it is a journey, and often it takes a while to get that wow.
Yeah. And you can look and think, and then you're totally focused on one area. And so quite often we'll get a photograph from a patient and there's a really zoomed up a little tiny area of the wound. And actually it's a tiny little, it's a square centimeter in comparison to the whole result. And we're trying to get them to focus on, like, how do you feel? How are you feeling? Are you eating normally? Are you sleeping well? And only when you're really back to all those things is your body going to really heal, and you're really going to get the full advantage of the surgery that you've had. So, and the realistic journey is that you know, we know there'll be bumps in the road. We just don't know where they're going to be,
No.
and how big they're going to be. But we will be there either side to catch you whenever you come through it. But having a realistic idea that you're not going to always be the super flying through top patient in the class, and saying you don't get any extra medals for not taking the pain relief, I only stayed in bed for 1 day after my surgery. All those, you don't get any extra prizes for that. So you better just have a realistic idea of what's going to happen. All right,
Garments.
Yeah.
You will be asked, and we will discuss, both Ms McGoldrick and myself will be discussing garments with you and requirements for after surgery. Now, there are a plethora of garments on the market, and they come in very different sizes and ranges and brands. We don't affiliate ourselves to one particular brand. We think it's very much up to the patient to make a choice about what garment will suit her body, what price range is important to them. But we would like all patients to wear some form of compression for approximately 6 weeks after surgery, whether that be a bra, if you've had breast augmentation or reduction, whether it be a girdle or a pair of high-waisted pants after surgery, if you've had an abdominoplasty or liposuction. Garments are designed to be comfortable, but they can be hot and quite restrictive. And what I say to patients prior to surgery is try them on and wear them and see how you feel with a form of compression. Now, many patients already have compression, as in they've previously bought some if they're wearing garments underneath their nice evening dress, etc. So they already are used to some form of compression. But before surgery, try them on and wear them, even if it's just for a day, to get used to the pressure and how they make you feel. Bear it in mind, when I say to patients at 6 weeks, you can take your garments off now, often I hear, no, oh no, I can't some patients can't see themselves ever removing the garments ever again, because you get used to the pressure and you get used to the security, and it can be quite a wrench when we say you don't have to wear them now. So they are comfortable as the weeks proceed.
Yeah, but that first time you try them on, just you feel a little bit like a squash sausage being held on. And getting it on is a two-person job. So, you know, quite often when you're in hospital, there will be you as the patient and two nurses helping you get your garment on, helping you get your bra on. And we generally don't put on the garments in the operating theatre. So as soon as you come off the operating table, we don't put them on. Only because it's quite difficult to put these big pants on a person when you're asleep. When they're asleep, it's really quite difficult at the best of times. And also it's easy for there to be a seam that's sitting in the wrong place, or you've nipped a piece of skin that's then uncomfortable for the patient a little bit later on. And also when someone is coming around from anaesthetic and they're a little bit disorientated, for someone to suddenly be starting pulling at their underwear can be a little bit distressing. So whenever you're then awake and able to cooperate, then we will put your compression garments on. So you won't wake up with it on. We will need to wrestle it on you at a point in time that you're able to cooperate with it. And there, you know, sometimes people have bought a compression garment and it's just not right and it needs to go back and we need to get another one. So I would encourage people to buy one or two, but they are expensive. So that's why it's worthwhile shopping around. Maybe you go for an expensive one and a cheap one, and then we can alternate between the two for laundry as needs be. There's a lot, whenever you go on these websites, there's just the vastest number of products. And a lot of them will be good, but a lot of them are really just trying to upsell you like this for anything.
Yes.
So one of those things is foam. So you'll see these different grades of foam that you use at different weeks of your recovery. Some patients do find the foam useful, but it's really just the sort of memory foam that you would use in a nice mattress. So if it needs be, you could modify Blue Peter, your own version at home that you could use. But it's not always necessary, and we'd encourage you to shop around. And I put this photo up because we always have a good chuckle amongst ourselves that the models that they choose to model the compression garments are the patients most likely who don't need any compression garments or any plastic surgery of any description. So that's why I put the picture up, just for us to chuckle about it.
It's important to bring your garments into hospital with you,
Yeah.
and it's important to choose a garment that you feel like you'll be comfortable in.
Yeah, and you will be expected to provide that in advance, and beforehand the hospital doesn't provide it, mainly because I don't know where they would start to have a wardrobe that would have every size.
Wouldn't be enough.
There wouldn't be enough space. Okay, this is your sort of area of expertise.
So yes, before surgery, I say to all patients to try and get your skin as in good as a condition as it can. Your skin is the largest organ of the body, and a lot of people sort of forget that. I know, me included, I don't moisturize every day, but when you're preparing to go for theatre, you need to make sure that your skin is in tip-top condition. Some patients, I would even say, why don't you consider some collagen, because it helps to build healthy skin, but moisturizing really is a very important simple thing that everybody can do at home to improve the quality of their skin. And it doesn't have to be a super expensive moisturizing agent. It can be E45 or something, or an aqueous cream, something off the shelf. But the importance is doing it regularly. If you're thinking about surgery, I would encourage all patients to massage and moisturize at least twice a day the area that the surgery is going to be done to. It's very, very important. Some patients ask us a lot about manual lymphatic drainage. I think it does have its place. I think it's good for a patient to research about this. It does have benefits and it will help you recover quicker. Make sure that you go to somebody who you trust and that you are comfortable. It adds costs, as anything does, and I'm being very realistic, but it will help your result and it will help the reduction of swelling. And of course, weeks before it goes from the body that you've had surgery on, but 12 weeks for a final result. So many patients do, especially if you're having large surgery on more than one area, or surgery which is completely changing your body image. it is useful to at least consider it. A lot of manual lymphatic drainage therapists would like to see you in the first early days after surgery, which when I say that to patients, they can't believe how they can even get out of bed at that stage. But that's what's often advised by an MLD therapist.
And it's very light touch. So the picture
Yes.
that I put up there is of quite a deep massage. The manual lymphatic drainage therapy is really very light touch, and especially in those early days post-operatively, it will be a very, very light touch. And then it increases as you're able to tolerate it. I think in terms of the manual lymphatic drainage therapy, it probably gets you to your final destination quicker, but I don't think it necessarily changes the destination that you're going to get to. So it's not going to radically change how you look a year or two down the line, but it might mean that you get there at 3 or 4 months rather than at 8 or 9 months. And also it's quite nice to have someone, pamper you, take care of you, and it's a nice special time for yourself. So, and all of that has great benefits in terms of keeping you calm, taking the stress out of things, allowing your body to recover. It's particularly useful, I think, for liposuction, because in liposuction, we damage a lot of the fat cells over a wide area. And while I suction a lot of it out at the time of surgery, as it says in the name, there are still a lot of damaged fat cells in there that are not removed, which we are relying on your own body's immune system to mop up those dead fat cells and eject them out of your body. And that means you're suddenly putting a lot of load on your own body's lymphatic channels. And that's where it really comes into its own, because it's encouraging that to work as efficiently as possible to clear out all those old dead fat cells. So they're out of the way to do the work that I can't do with the liposuction machine on the day of surgery. Similarly, abdominoplasty, when there's a long scar along the lower part of the abdomen, a big part of the lymphatic drainage going from your legs upwards in your body have been disrupted. And so we're looking for the lymphatic drainage in the other parts of your body to take over. And so I think it's particularly useful for that.
Yes.
And I would be encouraging those patients to try and find a lymphatic massage therapist, and we will be able to advise on that whenever you come to see us. And then in terms of taping.
Scar taping. So there's been lots of research done about taping, and taping is done at the time when your wounds are healed. The point of a tape is to provide some pressure on the scar to help it mature normally, because there are problems with some patients having lumpy scarring. Now, some surgeons would say, we'd like you to tape your wound for 12 weeks. I think that's a long time to have a bit of tape on, but most times we would say about 6 weeks, and then you can begin to massage the scar with a suitable emollient and to provide that pressure and moisturizing cream. But it will benefit you. It will help the scar. Bearing in mind that scars take about a year and a half to become fully mature. That is quite a long time, but it will give you the better result.
Yeah, and the benefit of the taping is to encourage the collagen fibers to lay down in an organized, linear fashion, so that they're not lumpy and not disorganized, so that they mature. And your body will do that eventually by itself, but it's trying to encourage that early laying down of collagen to be in as nice and orderly fashion as possible. And similarly, there's lots of tapes on the market. Again, if you look that up, there's huge amounts of different types of tape. And really the evidence is that it's the physical pressure of the tape rather than any material or chemical or substance that's in the tape. So if you get a roll of silicone tape that someone give you, that's probably going to work just as well as the paper tape that we will probably recommend, because we'll recommend whatever we think will be the most as effective to the lowest cost. So yeah, there's lots of things, and when you start to Google on it, you'll get totally bamboozled with what's out there. So again, that's something to bring us the product, show us, and we'll tell you or give you our honest opinion about whether we think Googling whether it's useful or not. Yeah.
So wound management and follow-up then. I see all the patients at a point of about between 1 week, but normally 2 weeks after their surgery. At that stage, they'll be exhausted because they've been at home on their own for 2 weeks with their wounds. And I suppose going home with wounds after surgery, I liken it to going home with a new baby often to patients, because they don't really know what they're looking at. They don't really know, and there's a great deal of anxiety often at the first appointment. The first appointment, I explained to the patient that I'm going to remove all of the tapes and dressings that were put on at the point of surgery. And it's often the first time that the patient will look at the wounds. And I often encourage patients to look at the wounds when they're in the room with me, just so that when they go home, there's no fear. Of course, there are those patients who don't want to see, and that's perfectly all right. Everybody's an individual. But I stay in contact with the patient and see them regularly. until the end of their healing journey, which for many patients is about week 6. Now, there's a variety of dressings that are used, a variety of dressings that we will provide from Kingsbridge for your journey. Very rarely would I have to get a patient seen by a treatment room nurse or a practice room nurse in your local area, but still, I'm not saying that this has never happened. Generally, dressings are all very simple. Occasionally, we have to use negative pressure if there's been some wound breakdown, which isn't uncommon, but happens very rarely. Antibiotics occasionally are used, and again, that's back to one of the risks and complications that you will have already understood, if there are any wound infections. And there's always somebody to call at Kingsbridge. It's a very important thing to remember. Just because you're an outpatient, it doesn't mean that the care stops. Upon discharge, you're given a number for the ward, and if there's any fear or you get a gut feeling that something isn't right, there's always, somebody to help you and to give you that reassurance, whether it be your consultant or one of the nurses or myself. So I encourage all patients when I see them initially to contact the ward if there's any problems, and I say as you get that gut feeling. Now, the majority of patients, especially women, especially mothers, if they have a problem, they would say, no, it's fine, I'll ring tomorrow. If you get that feeling, we need you to call just for reassurance. And 9 times out of 10, there's absolutely nothing wrong, but it's best just to call anyway.
Yeah, absolutely. And the dressing that we put on at the time of surgery is in that top picture there. So it's a piece of mesh, sort of plasticky mesh that's laid on the wound. And then the little pen has some glue in it that will only set then whenever it's on the wound. The benefit of that is that it's partially see-through, so you can see the wound, so you can see if it's going red, or you can see if there's something weird going on underneath, so you can see through it, so you can monitor your own wound. And it's totally waterproof, which means that you'll be able to shower the day after your surgery, and that will all stay on, and it will protect the wound underneath until you come up to see Pauline. And it's a great dressing, and we like it mainly because you can see through it, so that you can monitor your own wound. Evidence is that if patients are able to connect with their own wound and their own scar from the first time of surgery, they are less likely to have problematic scarring or problems with their own perception of their bodies afterwards. So this is important for us, that you see it and that you know that we're not hiding anything away from you. Then after that's removed, quite often there's 1 or 2 small areas that may need a different type of dressing. And that's where we quite often use that inidine, that sort of like brown iodine dressing that you might have had when you were a kid with a grazed knee, and then just a simple little dry dressing that you can change yourself. And we would encourage you to, Pauline will advise you how often we think you need to get it changed. And then again, rarely we need the bigger dressings. That dressing at the bottom has a little tiny battery pack, and it puts some suction through the dressing, holds the dressing in place, and any fluid that might be in the wound gets drawn away. And thankfully, you don't need to use that too often, but occasionally it is necessary. And we will advise you on how to manage that. Again, antibiotics, we can normally get antibiotics to you within the day, and we would encourage you to get in touch with us because we can get it to you pretty much wherever you are, rather than phoning your GP or going to see out of hours, because that's really what the package of care that we have for you includes that. And again, as Pauline said, get in touch if you're concerned. It takes me 2 minutes to look at a picture of a wound and say, I'm not concerned about that, but you have never had a wound before, so how on earth would you be expected to know that? And you will hopefully always be greeted with I'm glad you got in touch. It's lovely to hear from you.
Yes.
And that would be our guiding principle, that we're 9 times out of 10, 99 times out of 100, we're happy to hear. Even if it's late or over the holidays, and that's where people get nervous about trying to get in contact with someone. So we would encourage you to get in touch, and we can always. Things are usually very easily remedied.
On the point of showering, it's very important to shower because it helps your well-being after surgery. Nobody wants to be unshowered for 2 weeks because they're too afraid to get their dressings wet. It's very important to act as normal as you can. And whether that just be a light, quick shower and a dry after, it's important because it makes you feel better. It gives you a chance to wash your hair, all those normal things that you would be doing that will help your recovery.
Yeah, and then we normally say you can either pat it dry with a towel or the cool setting with a hair
dryer. Just game changer.
Blow dry yourself dry. That has been a game changer for people. Yeah, super. Okay, so that's the end of our little spiel, and I'm hoping that you have all found it very useful. And
bring on the questions.
If you have any questions.
I'll volunteer this time. So just with regards to the dressings,
Mhm.
do they have to sometimes do their dressings themselves?
Yes,
home?
yes.
Do you send them away with some dressings?
Yes.
Do you
It-
teach them?
It depends on the complexity of them, and as I mentioned, that sometimes is the rare circumstance that I have to refer you to a practice nurse, but that happens very rarely.
And usually patients who are traveling a long distance.
Yes,
So we have
so
some patients
cross-border.
from Galway or
Yes.
Cork or whatever, and we'll ask maybe their practice nurse to step in and give them a hand, but that would be unusual.
Very rare, but the majority of patients between themselves and myself manage very well because they're basic dressings that don't need any nursing knowledge. I'm not belittling my job here, but I don't need any nursing knowledge at home to do. I write all the instructions down and you're given all the supplies to go home with.
I also wouldn't underestimate the other halves. I had a patient yesterday.
nurses.
Yes, I haven't seen my wound. My husband's been doing all the dressings, and I was very impressed with that. He's not a nurse; he's never done that before. But yes, exactly. We were.
Husbands like to shine.
Yes.
Good. Okay, cool. So we can probably do this question together. When can I drive? When can I exercise?
The reason why you can't drive is because you need to be able to safely perform an emergency stop or an emergency turn of the wheel, which for most patients in most settings is around 2 weeks.
Okay.
If you've had a huge tummy tuck and you will not be able to do an emergency stop, and similarly if you've had breast surgery, you won't be able to do a big turn of the wheel. So we would encourage you to, and we'll be at each time you see us, that's the time to ask, is this the time that I can drive? And we'll be able to guide you. And essentially it will come down to how you feel, but it's always useful to seek guidance.
Okay.
In terms of exercise?
Well, this is often something that the fitter patient really does struggle with, because when we say to you don't exercise, then you have a massive drop in endorphins.
Yeah.
And it can leave you feeling quite depressed in some cases if you're used to daily exercise. However, you can walk as much as you want to. And indeed, I encourage you to go out, or I encourage you to walk if you feel able to walk, depending on your surgery, because I don't want you getting a clot. So walking as much as you actively feel able to, but no organized gym classes, no exercise regime.
Yeah. And that's the reason for that is twofold. First of all, you'll have a wound that won't have been developing its full strength for 6 to 8 weeks after surgery. That scar is not yet mature. It's not quite doing its own. My sutures are good, but they're not that good. So, whenever you see a suture, it's a really little thin bit of thread, and it's holding, in the instance of, say, an abdominoplasty, it's holding a lot of things together. So we don't want to put that under strain. The other thing is, so then people say, well, if I don't do weights, I could maybe do a little bit of cardio, just cycle a little bit on the bike. The problem with that is you're putting your blood pressure and your heart rate up, and all the little blood vessels that I have damaged in the part of during surgery are all still quite leaky. And whenever you increase your heart rate and blood pressure, they all leak a little bit more. So you're more swollen, so it will take longer. So when we were saying that manual lymphatic drainage, what you get you to that end destination quicker, exercising too early will put that end destination off much, much longer. And so that swelling will last for much, much longer, and it will take an awful lot longer if you get to where you are. So you're increasing your risk of complications, wound problems, and you're going to delay your ultimate result. So, but it is difficult. It's
non-negotiable though. So.
Pauline has spoken.
Sorry.
We're done. Okay. So with regards to the compression garments, how do I know what size to go for? Like, how do I work that out?
So there's a lot of advice on the garment websites that we will point you to. And many garment websites would say, measure yourself as a pre-operative patient. You don't need to go up or down a size depending on, I wonder what I'm going to look like. So the current size, if you're going for a garment, say from shop, the UK clothing size that you would normally fit comfortably would be the size that you would go for.
They're designed to be compressive. So, and it's rare that we change people from a size 16 to a size 8. That, there is no surgery that I do that will change that sort of transformation. So it's usually variations, but the elasticity of the compression garments takes that into account. So we want there to be circulation getting to your legs and circulation getting to your arms from your bra. But apart from that, it's the size that you're at, and it's not usually far off.
Okay. So, how many appointments will I need? So, like from coming to have initial consultation to being discharged?
So initially you'll come to meet me
Mhm.
and we'll have pretty long consultation.
Mhm.
Then after that, you will then have another consultation then with Pauline,
Mhm.
and that's to fill in any blanks after you've had a chance to read the written material that I have provided you with.
Mhm.
You'll then have either a virtual or face-to-face appointment with Pauline, depending on the nature of your surgery. You'll then have another virtual consult with me. So that's three appointments before we've even got you a date for surgery. And occasionally we'll need to see people more often than that in advance if there's more than one body part that we're working on, or if there's a medical issue that we need to discuss. So 3 would be the bare minimum before surgery. And then after surgery, we normally have an appointment with you sort of 1 to 2 weeks post-op.
Yes. And then how many
You
other
need.
appointments that you need until I'm confident that you're healed?
Yeah.
Okay.
So I then normally will see at around 6 to 8 week mark, and that will be to check how you're, that by that stage you should be getting back to more normal things. The final result won't be quite there yet, but we'll be well on our way. We'll be able to signpost if there's anything that isn't quite right or anything that you're not happy with. And then I normally see one further time 6 or 8 months down the line.
Okay.
One thing I do think is important to say is after your first appointment with your consultant, and then you see the nurse, and then you go back to your consultant again, and say if there's a bit of a delay or a bit of decision-making time, which is we encourage, say if that runs into a couple of months, and then suddenly you get a word from the hospital about theatre, it's always very important to see your consultant a couple of weeks before surgery, just in case anything has changed with your medical history, anything has changed within yourself. Have you put on weight? Have you lost weight? Which could affect your result. It's important to schedule one more appointment quite near to any surgical date.
And for our practice and Mr. Hu's practice, you will have a link in your email, which will allow you to book a virtual appointment with us whenever suits. So you get a date for surgery, go on there, click the link, book a quick appointment with us. You can do it from home. It'll be in the evening. It's not going to take, you're not going to need to take an extra day off work. And we can just run over everything. You settle your mind that you've covered everything. I settle my mind, remind myself where we're at and what the pertinent issues are. And then we can go over things as needs be. And that's really
safe practice.
Yeah. Okay. With regard to lymphatic drainage, is lymphatic drainage treatments advised if you're going direct to implants? Should we be doing this before or after surgery?
So if you're going to direct to implants for breast augmentation, so it wouldn't be a standard procedure that we would recommend manual lymphatic drainage.
Okay.
Some patients benefit from it before and afterwards. But generally, if you're going to have manual lymphatic drainage, you've met with the therapist, and quite often you have one session before surgery so that you have an idea of what to expect, what the light touch is like. They get an idea of what your tissues are like and what the issues are likely to be, so that whenever you're coming to see them for that first appointment post-op, that you're all on the same page and you know what you're dealing with. Breast augmentation would not be a standard treatment that we would normally recommend manual lymphatic drainage with, though. But I'm not saying that it's contraindicated. If someone felt strongly that they want to benefit from it, I wouldn't have an aversion to it, but it wouldn't be one of those ones that I would say was
It's a personal choice, really.
Okay. And the big question, how soon can I have surgery at Kingsbridge?
Well, quite often the limit for us is getting into sales for the first appointment, and that's a little bit strategic on my point, because there's only so many hours in the day, and there's so, myself and Mr. Hu have an NHS practice as well. I have children that need managed, all the rest. So I won't want you to be on a waiting list for very long. So once we've made the decision to have surgery and you've seen Pauline and we're all ready, I would like there to be a couple of months at maximum before you're able to have your surgery.
Okay.
So I will limit the amount of new patients that I'm seeing in the first instance. So it may be that you're waiting 3 or 4 months to see me at outpatient clinic and you're getting a bit frustrated. Totally understandable. But the benefit is that whenever it comes to actually booking the time for surgery, it should be within 2 to 3 months of the first time that you meet me. And it's that for a reason, so that everything is pertinent, that your medical history is still relevant, that you haven't forgotten what we're planning to do. And so that's why. So normally 2 to 3 months would be the standard. And you know what? It takes you that, and you can see from what we talked about this evening, there's a lot of preparations that need to be made in that time. So trying to speed it up much quicker than that probably is going to be detrimental.
Yeah, it's not advised.
So, but once they get to see you, get in front of you, actually their route to surgery
It's
is
pretty quick. And that's deliberate. So what, you know, I know how many patients I can operate on each week, and we know what the throughput can be and what we can manage. And so we are sort of managing the inflow. I think it's unfair to see someone at clinic and then make them wait a year to have surgery. That would be unfair. So the sludge in the pipeline is very much coming in to see it in the first instance.
And some of it too is that it's your choice.
Yeah.
It needs to fit in with your life. It needs to fit in with your plans.
Yeah.
And yes, it will also need to fit in with the surgeon's plans, but we take that in mind as well, because you're the number one in this.
Yeah.
You're the one having the surgery.
And we would encourage you to, you know, quite often, especially if you've waited a little bit of time, you're super keen. And every so often people will say, you know, when can it happen? When it can happen as quickly as possible. And we would be encouraging you to choose the date that's going to fit in with everything. Don't take the first available date, because that might not be the best one for you. And I would prefer you to take a later date. That means that you're able to have all of your food preparation, and that you have someone to look after your kids, and that you've
Mentally ready.
and you've tidied up everything from work, rather than rushing in to take the first available date that then leaves you a little bit stuck.
Okay. I'm going to keep that this way now. Sorry. Okay. So thank you all for joining us this evening. Your questions were really interesting. I hope we've covered some things tonight that you were concerned about or wanted to sort of address before coming to see us. You can see my email up there. If you've any further questions, or you suddenly think of something, please feel free to email me directly, and I can pass those questions on to Ciara and Pauline. But thank you very much for joining us tonight.
Thank you, Steph.
Thank you.
Good night.
Thank you so much for being wonderfully informative as always, and enjoy the rest of your evening. Happy Easter.
Thank you.